very best thing about what I do is having the joy of being able to help somebody when they've been seeing many practitioners for years, and after we work them up and treat them, then they're able to function normally again. Hi, I'm Dr. Davison with Articulate TMD Diagnostics. I'd like to take this moment to thank you for coming by so we can let you know who we are and explain how we may be able to help you. When we first see somebody for the first exam, this is not a 5 or 10 minute quick look at you. It takes an hour to 2 hours because it's a complicated joint, it's a complicated area of the body. You've got to look at the patient as an individual. You've got to take the time to try to sort out what their problems are and customize a treatment plan to that patient. All the work, as far as the work on the patient or treating the patient, is provided by me. I don't have a staff of 20 girls that worked at McDonald's hamburgers, cooking hamburgers last week, doing the treatment. We're doing it ourselves. Also, most orthodontic practices today do not have an in-house lab to customize and make that orthotic individually for that patient. Our lab is in-house. We can design it, we can prescribe it exactly for what that patient needs. It's not sent to California or sent to China and made off a model and sent back to us and then just snapped into place. I think that's the biggest thing. We try to figure out what that patient needs. We try to individually treat that patient. It's done in-house, it's not sent outside. And we try to have empathy and understand this can take a long time to start getting them comfortable. I want patients to really understand that I do have a lot of empathy for what they're going through. Because I've gone through a lot of these things myself because I have post-polio and I've had to deal with these kind of issues. I had an older lady, she's about 80, she's in her 80s, and she's begun to suffer some dementia. And she had collapsed and many strokes and some things like that going on that's affecting the neurologic symptoms. But she was also having these miserable headaches. Her doctor was telling her that the headaches were due to the many strokes. When we examined her, it was obvious she had a major TMJ problem. We made an orthotic. Her son really questioned what we were doing because he was convinced it was due to the strokes. And after we got the orthotic in, we saw her a week later, and she said, the pain's all gone. She said, I'd been going around at night from bed to bed and couches trying to find a place where I could be comfortable because my head was hurting so bad. And after we made the orthotic, the pain went away. One obvious concern to everybody that walks in the office is the finances. This is expensive, it's all custom. It's nothing is picked off the shelf. Whether they have coverage or not, though, we will work with them as far as financing. We do not expect this all to be paid at one time. And we can spread this out over several months depending on what kind of services and the costs that we're providing at the time. And our front office is very good at trying to help people with that. However, there are some people that's not a problem, and if they choose to prepay and want to do that, we'll also work with some discounts to help them. Surgery is usually not necessary in the TMJ. In fact, it quite often can make it much worse if you do surgery. Because when you function with your jaw, if you close down and clench, if you have a properly made orthotic that moves the pressure from the joint, out of the joint to the teeth, then you're not loading that joint. When we walk, though, we have to load our knee joints. So we cannot function and walk without loading our knees. But we can function here and chew and clench if we have a proper orthotic without loading that joint. Our office is dedicated to treating each patient as an individual. Look, I know you're really in pain, and we're going to devote the necessary time to give you a proper diagnosis and adequate treatment. I'd just like to take a moment to thank you for watching our video, and I look forward to helping you solve your problem.